So I've been asked numerous times to talk about this. Now that I've garnered enough experience to talk about this topic, I believe that it will benefit a lot of those people who are trying to go down this pathway. So without further ado, I wanted to talk about AE and CCAT. For those who don't know what AE is, it is Aeromedical Evacuation, and CCAT. Now these are two pathways a nurse can take when it comes to flying as a nurse. I know you joined the Air Force for you to try to get into the operational where you could fly and do all the cool things. AE is one of them, and also CCAT. I do CCAT. Now I don't want to draw this topic out only because I could talk about it for hours on end. To keep things short, CCAT is critical care air transport, which is the ICU equivalent of basically flight nursing. Is it flight nursing? Technically it is, but it's not your full-time job. Now before I delve more into the CCAT realm, let's talk about AE. Aeromedical Evacuation is an air mobility command asset. So AE technically does a lot of missions. Now think of med-surg in the air. You will be dealing with more patients than CCAT does. And the primary job of AE is basically to maintain the rear of a C-17 or a C-130 or a KC-45. The training is a little bit more in-depth when it comes to AE. I believe the pipeline was like 4 months long, and the pipeline takes place at Wright Pat. If you're AE and you're seeing this video, comment down below. I'd love to hear what you can chime in, because I'm not AE. Because I'm not AE, would I like to be AE one day? Possibly, but we'll talk about that further down the line. Now with AE comes the responsibility of not only the aircraft, but also your patients. Now AE teams, they work in a crew, so they are considered part of the crew when you fly. So they have a mandatory rest time versus CCAT, which does not have a mandatory rest time. AE has a mandatory 12-hour rest after every mission. Now AE, I have it pulled up right here, is composed of a certified flight crew. It's 2 nurses and 3 medical technicians. Correct me if I'm wrong. If you are AE, that's what the team looks like. It's a total of 5 personnel. Personally, when I've flown, I have seen about that number, and usually I've seen them tag along more personnel just for flight hours. So, that's another thing. AE does have a mandatory requirement of, I don't know how many hours per month, but they are required to fly an X amount of hours per month. One thing I failed to mention is AE they have order sets that they have to abide by, and they cannot go outside what is binded to their practice. Let's say, for example, there is no CCAT team on the airplane, right? There's no doctor to say that this patient needs to be upgraded. If they are transporting a regular AE med-surg patient that needs to be upgraded, they personally cannot make the decision to say, let's upgrade this patient. They could only divert the patient to the ground for escalation of care. That's one of the major things, is AE abides by a set of rules, and just overall they have to follow policy, and there's nothing wrong against it, just very stringent on how their rules and regulations are imposed. Now with CCAT, we don't fly as much. We fly when there are critical missions. And the CCAT team usually consists of 1 nurse, 1 RT, and 1 doc. Think of it as a ICU in the air. This team specifically caters to 1 to 3 patients, and yes, we do take up to 3 critical care patients if needed. On a good mission, once we do transport these patients, we are able to get rest after, so our rest kind of coincides with that of the AE team until we're alerted to fly back to our post. Now again, I cannot talk more on the AE team. If I had the choice to go back and reapply into the Air Force, I probably would have applied into an AE team, only because they do a lot of the mission, and the mission to me, the mission's cool. And the fact that they're able to fly all the time, do things that we're not able to do, like maintain the back of a C-17, I think that's awesome. That's an awesome feat for them to have. Usually a lot of the AE nurses that I do speak with, or the AE techs that I speak with, they love what they do. And compared to that of CCAT is a hit or miss. Depends on whether or not you love what you do. And personally, I don't see myself being in CCAT for an extended period of time. I myself am going down the leadership pathway. But yeah, besides that, that is just to scratch the surface of what AE and CCAT does. Just remember that with AE, you have a team of 5. Again, if I'm wrong, correct me. And with CCAT, you have a team of 3. I didn't want to make this long and drawn out, only because there is a lot to expound upon. to which I will try to get an AE personnel I can interview for future reference for videos. But besides that, got another video on the way soon. And yeah, I hope you guys are doing well. See you guys in the next video I produce. You guys take care. Bye.